What's going on, world? Hey, happy Friday. Black Friday. Hopefully everybody had a really good Thanksgiving. You guys already know what the deal is. Your boy's a little bit late, but it's okay. Better late than never. You guys already know what the deal is. You guys are knowing what we're doing today. We're doing NCLEX questions. Just because it's Black Friday don't mean we ain't doing nothing around here. All right, just because it's Black Friday don't. And first of all, y'all ain't about to go out there and spend no money anyway, okay? Because groceries is $1,000. Okay, it's $1,000 to eat out here. So y'all ain't going out there and buying nothing unless groceries are 70% off. You know what I'm saying? So hopefully everybody had a really good Thanksgiving. If you guys are new here, we are about to do NCLEX questions. We're about to do NCLEX questions. We got these questions off nurseslabs.com. You know, we do this we about to start doing this every day. You know, you guys ask and I shall, deliver said request. If you guys are new here, welcome. Make sure you guys like, share, follow. That's a trifecta that TikTok needs. I was about to say TRICARE, like this is insurance, right? So you guys already know the deal. Hey, once we get 100 folks up in here, I see somebody who's a nurse that just became a nurse up in here. Miss Kentucky Boy Mom, I see you out there. You guys already know the deal. Once I get 100 folks up in here, we're going to turn this camera around. We're going to get it on and popping. All right. Like I said, I want to know who you are, where you're from, where you're at in your nursing journey, as well as if you're not a nurse, what you doing here? You know, you're trying to get your learn on, trying to be nosy, like you want to be a nurse. You want to talk shit about nurses, like what you want. All right. Also, 7-day NCLEX course, y'all. 7-day NCLEX course. It is now $97. You guys can go check that link out. It is in my bio. Hey, once you get it forever. Megan, yes, that's what I'm talking about. Here, hey, you here on time. And I appreciate you. All right. So, hey, like I said, 7-day NCLEX course. That course is now $97. Also, I made a ebook. That ebook is like over 700 pages, y'all. 700 pages, and I'm gonna keep refining it. All right, I kind of got a little happy, kind of got a little overzealous. You know what I'm saying? So, but your boy put all that information in there for y'all, so y'all could use that. All right, yo, we got 170 something people up in here. You guys already know the deal. Smash that like button. I know y'all don't want to hear me, so let me turn this thing around so we can get this thing going. It says general transfer studies. Then once I do T's for nurse school, shout out to you, to the realists. All right, shout out to you. Hold on one second. Turn this camera around. You guys already know the deal. Hey, a little bit of housekeeping for those that are new here. We're about to do NCLEX questions. I got these questions off nurseslabs.com. Also, make sure you guys participate. That is what keeps the whole thing going. I need your participation. If I don't get that, then I'm assuming that you don't want me here and I'll just go the fuck away. But no, I ain't going away because y'all can't get rid of me that easy. You know what I'm saying? So, hey, like, shares, and follows. I need that. That's what I need. That's what TikTok needs. And plus, that's what you like to do because, you're not selfish. And if you are, then we got to have a conversation. Okay? Hey, if you come into my chat and you act a fool, I'm going to ban that ass. Literally, it says I'm going to ban that ass. So don't be rude. All right? Don't be rude in the chat to nobody else. Okay? Like I said, also, I got these questions off nurseslabs.com. Right now, the 7-day NCLEX course for the weekend, it is $97. $97, y'all, and you get access to that for a lifetime. Nah, because if I was dying, I trust you with my life. That's what I'm talking about. I got you. I save lives. Well, you wouldn't be the first person, right? I had a team of folks that do that, all right? Hey, so also, that ends on the 27th, all right? Also, if you're looking for one-on-one coaching, that is also there. So let us jump into the questions. All right, here we go. Question number 1. When giving IV phenytoin, which of the following methods should you use? Using inline filter, withhold other anticonvulsives, mix the drugs with saline solution only, or flush the IV with dextrose solution. What are we thinking? Hey, if you guys are new here, welcome. Hey, we need 10,000 likes. 10,000 likes. Hey, for the last 2 lives, I've gotten over 50,000 likes. And we got to keep that up. That tells me that y'all are really appreciating this. And that tells me that y'all aren't selfish. Y'all are out there sharing, you're liking, and you're following. So make that happen. All right. And also, I got to put y'all on a timer because y'all talk too much. I'm waiting for somebody to talk shit, but y'all know what the deal is. Hopefully everybody had a good Thanksgiving. All right. I don't care what you say about, it being a pagan holiday or whatever. Look, hey, go out there and get you something to eat and be thankful for where you are in your fucking life. All right. And stop going out there and making other people miserable. You know what I'm saying? All right, y'all. 10 seconds. Here we go, baby. Here we go. In 3, 2. And the answer is C, mix the drug with saline solution only, right? It's only compatible to be mixed with saline solution, right? And that's part of physiological adaptation, all right? Physiological adaptation is the third largest section on the NCLEX at 11 to 17%, all right? That doesn't matter if it's the RN or the LPN, okay? This is important. Content, questions and answers with a rationale. You need to have all three of those. Studying for the NCLEX is not a game. It's not a joke. There are no tricks. The only trick is that you got to put in the fucking work, and that's not even a trick. You know, yeah, and that's not even a trick. All right, that's just, you got to go out there and you got to put in the work. Okay, here we go. Question number 2. After surgical repair of a hip, which of the following positions is best for the patient's legs and hips? Is it abduction, adduction, prone, or is it subluxated? Subluxated. Yep. Hey, I'm one of those nurses that I be messing up words. I'm just letting y'all know. What's up? What's up? Hey, if you guys are new here, welcome. I got these questions off nurseslabs.com. All right. Nurseslabs.com. They're free sets of questions. OK, so make sure you guys go over there and check that out. Also, I need for y'all to like, share and follow. I've been getting over 50,000 likes. I actually had 101,000 likes the other day, and it was crazy. And that was all because of y'all. And I appreciate that. So make sure you guys like, share, follow, get that out to the people who need it. OK, don't be selfish. All right. 10 seconds. Hopefully everybody had a really good Thanksgiving out there. Guys going out there giving thanks, you know, and being appreciative to where you live and being appreciative to how your life is, because it could be worse. Trust and believe. All right. Also, I want to know who you are, where you're from, and where you're at in your nursing journey. All right. And the answer is A, abduction, right? Part of physiological adaptation, third largest section on the NCLEX. After surgical repair of the hip, keep the legs and hips abducted to stabilize the prosthesis in the acetabulum. All right. Acetabulum. Can I please do stress and coping? Hey, whatever is on this one is on this one. However, we can talk about stress and coping like at a later time. I might actually just open up my website and just take requests and be like, hey, you know, or do a poll. You know, yeah, abductor pillow, right? Shout out to you, Jen. All right, here we go. Question number 3. Which of the following factors should be the primary focus of nursing management in a patient with acute pancreatitis? Is it nutrition management, fluid and electrolyte balance, management of hypoglycemia, or pain control? Amanda, SPN, looking to graduate July, NCLEX PN shortly after. Shout out to you, Amanda. Hello, made it. Someone said, hello, made it. How was the Thanksgiving was good. Thanksgiving was good. 34 years, mostly ER. Shout out to you, Miss Cricket. 34. Hey, I'm 36. I don't know how that makes you feel. Yeah, I said it. That's nothing but love, Miss Cricket, ma'am. Nothing but love. All right, y'all. Here we go. Here's our answer. Sage, thanks for the follow. Here's our answer in 3, 2, 30 years as an LPN. Shout out to you. And the answer is B, fluid and electrolyte balance. Acute pancreatitis is commonly associated with fluid isolation and accumulation in the bowel secondary to ileus and peripancreatic edema. Fluid and electrolyte loss from vomiting is a major concern. Therefore, your priority is to manage hypovolemia and restore electrolyte balance. That's part of physiological adaptation. Third largest section on the NCLEX at 11 to 17%. All right, y'all, it says, look at me. Shout out to Patho class. That's what I'm talking about. Shout out to getting that learning on. Morgan, not a nurse, but currently a farm tech. About to go to med school. Shout out to you, Morgan. Go get your learn on and go out there and be a good doctor. And by be a good doctor, I don't mean be an asshole. I mean, if you want to be an asshole, that's cool. But just know, if you're an asshole, people are going to be assholes back to you. But come with it, though. Come with the learning and the knowledge, though. We about it. Question number 4. After a liver biopsy, place the patient in which of the following positions? Is it left side lying with the bed flat, right side lying with the bed flat, left side lying with the bed in semi-Fowler's position, or right side lying with the bed in the semi-Fowler's position? What needs to be on the shirt, Happy Mom? Which one? I know a lot of stuff needs to be on a shirt. That's all y'all keep telling me. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. I need for y'all to smash that like button. Hey, first goal, we need 10,000 likes. Hey, 10,000 likes get you 10 questions. Hey, just letting y'all know. Also, make sure you guys like, share, and follow. Make sure you guys follow and share. All right. Share. Get it out to somebody who you know ain't doing nothing on Black Friday. All right. Unless maybe watching the Dolphins beat the Jets, but I'm pretty sure that game is over now. Khadijah says D. Okay. Hey, Nisi says B. Okay. Paula says D. Okay. All right. All right. Yeah, it's over. Yeah, it is over. It's over. I saw them get an interception and run it back before the half was up, and I stopped watching. So, all right, y'all. Here we go. Here's our answer. In 3, 2, and the answer is B. Right side lying with the bed flat. Positioning the patient on the right side with the bed flat will splint the biopsy site and minimize bleeding. Okay, so reduction of risk potential. All right, reduction of risk potential. Shout out to everybody that got that answer right. Remember, I got this. It's so important when you guys are studying that you guys have to read RTFQ. Read the fucking question. Oh, y'all didn't think I was going to say the F word? First of all, I've been in the Navy for 16 years. I've been a nurse for 3.5 years. My favorite word is the F word. And if you're a nurse or if you're not a nurse and you're going to become one, the F word will be yours as well. So get used to it. It's nothing but love, no disrespect. I'm just keeping it a stack, as the kids say. All right. Which of the following potentially serious complications could occur with therapy for hypothyroidism? Is it acute hemolytic reaction, angina, or cardiac arrhythmia? Was it a retinopathy or thrombocytopenia? Who says Mama Llama? Mama 11? No, Mama Llama. I got you. B. I had it myself. Oh, okay. Bella. Oh, Lord have mercy. Oh, here we go. Hey, Bella. How you doing? Guys, this is Bella. Bella, this is the guys and gals. Shout out to everybody. If you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Hey, after this, we're going to do an Ask Me Anything. Today is Friday. Y'all ain't got nowhere. Y'all ain't going nowhere. So sit here and just, kick the shit with me and y'all ask me these questions. All right, here we go. Here's our answer in 3, 2. And the answer is B, angina or cardiac arrhythmia. Precipitation of angina or cardiac arrhythmia is a potentially serious complication of hypothyroidism treatment. That is part of reduction of risk potential. I'm currently at work. Hey, so that means you ain't working. You over here sitting and listening to me. Is this from Nurse Lab? Yes. Is it nay? That's where I got them from, nurseslabs.com. You are correct, Mundo. All right. And reduction of risk potential. Smaller section on the NCLEX at like anywhere from 6 to 9 to 12%. Okay. It depends on what literature you read. But hey, real quick. Hey, commercial break. Don't y'all go nowhere. Hey, we're doing NCLEX questions. All right. Make sure you guys participate. I'm kind of funny. I'm well rested and I'm still feeling kind of fat and happy from yesterday. So, we good over there. Make sure you guys share, follow, give me all them likes. Don't be rude. Hey, and don't be selfish. Get it out there to those folks. You know what I'm saying? Get it out there to folks. You know what I'm saying? That's what I'm trying to tell y'all. Don't be selfish your whole life. Hey, if you come into my chat and you try to troll, first of all, I'm going to troll you back and then I'm going to ban that ass. Literally, it says I'm going to ban that ass. Okay. And I will ask about me. Okay. Nurseslabs.com is where I got these questions from. 7-day NCLEX course. It is no longer $48, ladies and gentlemen. It is $97. And that link is in my bio. Also, if you need one-on-one coaching or you want coaching period, check my link out in the bio as well. And we're also going to do an Ask Me Anything after this. Okay. Just learned endo in med school. And now I see this. Hey, is it Hamza? Hey, you came to the right place. Can you do funds questions? I can. So what I'm going to do is I'm going to start doing polls. So I'll try to do them the day before or whatever to see what everybody likes. That way we can do them all together because I know I get asked and requested so many. All right. Well, we'll work something out. All right. I'm definitely going to buy this book. What book? You talking about my book? Go get it. So question number 6, adequate fluid replacement and vasopressin replacement are objectives of therapy for which of the following disease processes? I don't know why that repeated itself, but is it diabetes mellitus, diabetes insipidus, diabetic ketoacidosis, or SIADH? CDI. Okay. Okay, what else are we thinking? Hey, welcome. If you guys are new here, yes, I know the question is repeating itself, so you don't got to state the obvious. That's number 1. Number 2, welcome. We're doing NCLEX questions. I got them off nurselabs.com. You guys can go over there and check those out for yourself. They're free sets of questions. They got a bunch of questions. They're really helpful, especially if you're in nursing school, but they're also helpful for people that are taking their NCLEX, okay? So they both go hand in hand. Make sure you guys smash that like button. I need 10,000 likes, y'all. 10,000 likes before we get to 10 questions. I'm just letting y'all know. All right? Also, I want to know who you are, where you're from, and where you're at in your nursing journey. If you're not a nurse, what you doing here? You know what I'm saying? What you doing here? Rocking with us, all right? Here we go, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is B. Diabetes insipidus, maintaining adequate fluid and replacing vasopressin are the main objectives in treating diabetes insipidus. That is physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. Someone who said they're from Alabama, been a nurse for 40 years. Shout out to you. It's Miss Patsy. We don't roll tide or war eagle here, you know what I'm saying? But I appreciate your 40 years of service, you know what I'm saying? Yes, ma'am. Taking my NCLEX on Tuesday. Is it K. Lauren? Hey, so on Monday, I better not see you in my live. You better be relaxing as much as you can. Steph said I've been an ICU nurse for 3 years. Shout out to you. Shout out to you, Miss Steph. I like listening to you guys learn something. Look, hey, I'm all about getting our learn on. I'm all about it. All about it. All right, here we go. Question number 7. Patient with type 1 diabetes mellitus may require which of the following changes to their daily routine during periods of infection? No changes, less insulin, more insulin, or oral diabetic agents. Going into my last semester of nursing school, is it Caitlin? Ma'am, shout out to you. CICU 1 year. Okay. Jess says C. Jay, appreciate the follow. MedSurg. I'm a MedSurg nurse, y'all. Ill. I mean, yay, that's so cool. Hey, I'm just saying ill, by the way, to Bella, not to MedSurg nursing, okay? I'm just letting y'all know. All right, what are we thinking? 10 seconds, y'all. 10 seconds. Hey, get carpal tunnel for me. Smash that like button. I need it. Make it happen. 30 years. Okay. Increase that insulin. You would need more insulin because your sugar is is high since you. Okay, all right, Sarah, smarty pants over there, girl. I see you. Few sim prereqs. I'll be there one day. Hey, you will be there one day. Speak it into existence, ma'am, and it shall be so. Here we go. Here's our answer. Where can I buy your book? So I'm working on the website right now. The only spot that you can buy the book is if you decide that you want to get the course. But that's going to be up tonight, and I'll make sure to put it out. I got y'all. I promise. Here we go. Here's our answer in 3, 2. And the answer is more insulin, right? During periods of infection or illness, patients with type 1 diabetes may need even more insulin to compensate for the increase of blood glucose levels. So whoever said that, y'all are right. RN 33 years CT, shout out to y'all, man. I got some knowledge up in this chat. That's what I'm talking about. Physiological adaptation, third largest section on the NCLEX, 11 to 17%. Okay. Hey, I just want to let y'all know, management of care or coordinating care, pharmacology and physiological adaptation make up 44 to 49%, almost half of the entire exam. If you can master those sections, I'm trying to tell you, you have an extremely high chance of killing that exam. I'm just letting y'all know. All right, here we go. Question number 8 on the follow-up visit. After having a vaginal hysterectomy, a 32-year-old patient has a decreased hematocrit level. Which of the following complications does this suggest? Hematoma, hypovolemia, infection, or pulmonary embolism? What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Okay, nurseslabs.com. Also, I need for y'all to smash that like button. I need for y'all to share, and I need for y'all to follow. I need for y'all to do that all the time. And if your fingers start hurting or anything like that, put the phone on the floor and start tapping with your toes, like Kevin Gates said. And then you can just be like, oh my God, you know what I'm saying? But 10 seconds, y'all. 10 seconds. I imagine that's how Bella sounds when she says stuff, but, whatever. Low blood. Okay. McKenna, thank you for the follow. Appreciate you. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is a hematoma. My bad, Bella. I'm sorry. The answer is a hematoma. A decreased hematocrit level is a sign of a hematoma, a delayed complication of abdominal and vaginal hysterectomy. That is reduction of risk potential. Hey, when you guys are studying for your NCLEX, you need to do your content, your questions and your answers, and you need to do your rationales. You need to read and you need to review them. There is no tricks, ladies and gentlemen. If you think there's a trick, hey, go eat you some cereal, because tricks are for fucking kids, okay? It's not a game, all right? Get out there and put in the work. All right, so here's the answer. Damn, I thought it said hemoglobin Bella. So you know what you didn't do? You didn't read the question. Y'all, Bella didn't RTFQ, and y'all know I got a problem with that, all right? You didn't RTFQ, and I'm mad now. Question number 9. A patient with partial thickness burns to both legs and portions of his trunk. Which of the following IV fluids are given first? Albumin, D5W, LR, or is it 0.9% sodium chloride with 2 milliequivalents of potassium per 100 milliliters? What are we thinking? LR, we got C's, we got D's, okay. Khadijah, what did you say? Khadijah said C, I think. I think she did. Yeah, she did. Is it D? I don't know. We finna figure it out. This is why I like doing it. This is why I don't answer the questions, y'all, is because we do them together. Just think of it as a group tutoring session. That's why I like to do these. Hey, by the way, we're going to go from doing these 3 times a week to doing them every day. Y'all asked me to do these every day, and I want to do these every day for y'all. So we're going to make it happen. All right. Ringers for trauma. Okay. Here we go, y'all. Here's our answer. Here's our answer coming in. 3, 2. Yeah, everybody's like, yeah, hey, I got y'all. Hey, y'all just got to show up. Y'all know what to do. All right, here we go. And y'all got to let other people know. But the answer is C. Lactator ringer solution replaces lost sodium and corrects metabolic acidosis, both of which commonly occur following a burn. That's part of pharmacological and parenteral therapies. All right, 5:30 Central Standard Time. All right, pharmacological and parenteral therapies, which is the second largest section on NCLEX at 14 to 18%. The second largest section, y'all. Pharmacology is a monster. Trust and believe. Your boy, hey, I failed NCLEX 3 times, and no part of me cares about telling any of y'all that, and no part of me cares about y'all's opinion. You want to know why? Because y'all's opinion doesn't determine what type of nurse I'm going to be, just like I can't tell y'all what type of nurse you're going to be based off of you not being successful at that exam. All right? Failure breeds success, ladies and gentlemen. It breeds success. So don't let people with their negative connotations come out there and run your mouth and try to bring down your shine. You want on? Hey, because they do, fuck them. I don't mean literally. I mean to say, forget them, but do you. Here we go. Question 10. Which of the following techniques is correct for obtaining a wound culture specimen from a surgical site? Thoroughly irrigate the wound before collecting the specimen. Oh my God. Use a sterile swab and wipe the crusty area around the outside of the wound. Gently roll a sterile swab from the center of the wound outward to collect the drainage, or use a sterile swab to collect drainage from the dressing. What are we thinking? I'll give y'all 15 seconds because I know I was over here running my mouth, so my bad. Who's that? Life is beautiful. I got you. You're welcome. Not a problem. That's what I'm here for. But yeah, hey, y'all, I failed my NCLEX 3 times. I've been a nurse for 3.5 years. I've worked in a burn ICU, a medical ICU, and a neuro ICU, as well as I worked in the PACU, and I worked in the operating room. Currently, the operating room is my home. All right. I've been in the Navy for 16 years, so I'm on that downward slope. Y'all already know what I'm talking about. So I appreciate everybody being here. But yeah, your boy failed 3 times. 3 times, and then he finally got it together. All right, y'all, here we go. Here's our answer. Thank you for doing this. I graduated in 2 weeks. Is it Kareen? Kareen, I got you. Haley, appreciate the flowers. And the answer is C. It says pass the NCLEX, but still feel I don't know anything. Peachy, that's okay. Any plans of CRNA school? Is it Isla? Ma'am, no. That was a long time ago, but not anymore. So the answer is C. Gently roll a sterile swab from the center of the wound outward to collect drainage. Rolling a swab from the center outward is the right way to obtain a culture specimen from the wound, right? That's health promotion and maintenance. Lower section on the NCLEX at about 6 to 9 to 12% of the NCLEX, okay? So make sure you guys check that out. NCLEX next month. This helps. Haley, I'm glad this helps. Hey, real quick. Hey, we're at question 10 and we ain't got 10,000 likes. What's wrong with y'all? Oh my God, Lord of mercy. Hey, get carpal tunnel for me and stop playing games. Hey, yo, we're doing NCLEX questions. I got them off nurseslabs.com, y'all. Nurseslabs.com. They're free sets of questions. Go over there and check those out for yourself, okay? Participation is the key. I'm kind of funny. Hey, I'm letting y'all know I talk that shit. Best believe, all right? But I do it, but out of nothing but love and sincerity, I promise you, all right? Hey, share, follow, and give me all them likes. Don't be greedy, and don't be greedy your whole life. Share this with people who you feel may need it, right? Y'all on Thanksgiving break, but best believe them tests is coming if y'all in school. You know what I'm saying? Also, you come into my chat and you act a fool, I'm going to ban that ass. Literally. I'm a ban that ass. I don't want TikTok to get mad at me, so I put money signs. And I ain't saying money goes in your ass, but you know what I'm talking about. Anyways, don't be rude, all right? I love y'all. 7-day NCLEX course. That link is in my bio. It is now $97, ladies and gentlemen, but you get the program for a lifetime. I will explain what the program looks like at the end when I do the Ask Me Everything, okay? Also, if you're looking for coaching, one-on-one tutoring for the NCLEX, that link is also in my bio, okay? Big exam on Monday. All right, is it Jamira? Okay, you got it. Kevin, I wonder how talk at the spades table. Look, ma'am, you don't want me at the spades table because it's just like asking me, hey, if you want to play Mario Kart. I talk that shit, and I will throw a fucking blue turtle shell at that ass, and our friendship will be over before we leave the house, okay? Question number 11. A nurse is administering IV furosemide to a patient admitted with congestive heart failure. After the infusion, which of the following symptoms is not expected, right? So what should I not expect? What should not happen when I give a patient furosemide, right? Increased urine output, decreased edema, decreased pain, or decreased blood pressure. Can I just write the exam? Is it Eshwar? No, you cannot. You cannot. And if you do find a way to write the exam before you go to an actual accredited school, you will eventually get caught, and then they will eventually throw you in jail for impersonating, right? And you can't just write an exam to be a nurse, because you have to go through the credentials of being a nurse. That's just like saying, hey, you want to go be a doctor? Hey, does this look like Catch Me If You Can? Absolutely not, sir. And if he is joking, I'm about to figure out if he's joking or not, because you already know a 600 is well on the way. It's well on the way. Stephanie Gonzalez, thank you for the follow. Appreciate you, Nay. Appreciate the follow. New grad on 3-week orientation. Catch Me If You Can. Look, hey, that's a great movie. Hey, Leo, Tom Hanks, great movie. Here we go, y'all. Here's our answer in 3, 2. And the answer is C, decreased pain. Furosemide is a loop diuretic. Does not alter your pain. Pharmacological and parenteral therapies, ladies and gentlemen. Second largest section on the NCLEX. Second largest section on the NCLEX at 14 to 18%. Y'all, you got to know pharmacology. Understand the classes. Understand what are the pharmacokinetics, right? What are you going to expect? Orthostatic hypotension, increased or decreased potassium. Like, what are we looking at? All right. Those are the things that you got to look at. OK, here we go. Question number 12. Y'all, we got 900 people in here. Hey, I need 20,000 likes. With 900 people, I need everybody to get carpal tunnel. Now, right now, make it happen. There are a number of risk factors associated with coronary artery disease. Which of the following is a modifiable risk factor? Is it gender, age, obesity, or hereditary? Or heredity? Somebody just jumped in here and said that this was easy. OK, you're right. The question may be easy, right? So 2 things that I'm going to go ahead and I'm just going to throw out there. Obesity, stop it. So some people don't even know what this is, because we got new people that come in here all the time, right? That aren't even in nursing school, but that are in prereqs. So this is new to them, right? Secondly, everybody is different. Thirdly, if you're on NCLEX and you get a question like this, do you think that you're doing well on the exam or not? What do you think? What do you think? Because remember, the NCLEX is all about clinical or critical thinking, clinical judgment, as well as application and analysis questions. That's what they want. That is what they want. Okay. And the answer is obesity. Stop. Yo, I saw that TikTok and that was probably one of the funniest things. She's like, I have OCD. Like, no, you have obesity. Yo, I about fucking peed on myself. It was so funny. But anyways, obesity is an important risk factor for coronary artery disease that can be modified by improved diet and weight loss. Okay. Also with exercise and all other good jazz. Okay. Hey, so health promotions and maintenance, ladies and gentlemen, health promotions and maintenance. Smaller section on the NCLEX, 6 to 9 to 12%. All right. Still a smaller section, but very, very important. It's part of the 8 sections of the NCLEX pie or the client needs. Somebody said, will this help with MCAT? No, because this is for nurses. Okay. Who said, wow, this is so easy? Hey, Eshwar, I don't know if you're joking, but yo, you're testing me right now, bro. And I'm telling you right now, if you feel it's easy, then go away. But if you don't, then just relax and just participate, bro. That's all you got to do. Okay. Here we go. Question number 13. Tissue plasminogen activator is considered for treatment of a patient who arrives in the emergency department following the onset of symptoms of myocardial infarction. Which of the following is a contraindication for treatment with TPA? All right, is it worsening chest pain that begins earlier in the evening, history of a cerebral hemorrhage, history of a prior myocardial infarction, or hypertension? What are we thinking? So, I mean, you're doing bad so it means you're doing bad if you're getting easy questions on NCLEX. That is correct. On NCLEX, the whole goal is you want to get to hard questions. That is the goal. You want to get to the hard questions. That is the goal. Okay. You always want to get to the hard questions. The harder the questions, the better. Like if I start talking about EKGs that you have nothing, that you know nothing about, you're gonna be like, I don't even remember seeing that in school. And you're like, okay, well, maybe I'm heading in the right direction. Okay. So shout out to all of y'all that are in here. Hey, at one point, can you explain how NCLEX works? So I'm going to do an Ask Me Anything after I do these questions. And then whoever is still here, and if you ask me the question, I have no problem answering it. But here we go. Hey, Eshwar, hey, if you say one more thing about some shit being easy, I swear to God, I'm going to give you a 600. All right. So hush. Here we go. So the answer is B, history of cerebral hemorrhage, right? A history of cerebral hemorrhage is a contraindication to TPA because it may increase the risk of bleeding. All right, TPA acts by dissolving the clot blocking the coronary artery and works best when administered within 6 hours of the onset of symptoms, which is physiological adaptation, third largest section on the NCLEX. Hey, when people start running their mouth like that, it's literally as if if I'm standing in front of the podium and you're talking while I'm talking. So, you know what I'm gonna tell you? Shut the fuck up. And I don't say that respectfully. I say that, yo, shut up. But I love y'all, you know what I'm saying? Hey, I don't let people mess with me like that. But I love y'all. I love y'all regardless, all right? So y'all give me a second. Because you already know where it's coming. There's coming. All right, here we go. And yeah, and like I said, some of these are not easy for people. They're not easy for people. All right. So no, I ain't mad. I'm good. I'm Gucci. We good. Question number 14. Following myocardial infarction, a hospitalized patient is encouraged to practice frequent leg exercises and ambulate in the hallway as directed by his physician. Which of the following choices reflects the purpose of exercise for this patient? Is it increased fitness and prevents future heart attacks, prevents bed sores, prevents DVTs, or prevents constipation? So shout out to everybody that's in here. We got 500 plus people in here. I appreciate y'all. I appreciate y'all working with it. Hey, 20,000 likes, baby. Let's make it happen. Hey, I don't let people affect me. I literally will just tell you, hey, chill out. Like, I get it. Like, you're telling me that it's easy, bro. I got it, you know, but it's easy for you. It may not be easy for others, because if it was easy, everybody would get it right. But you may be in a different position than other people. So be respectful of the people that are in here. All right. That's all I'm saying. But when you keep doing it, obviously you don't have any respect for me or anybody else that's in the chat. So obviously I got to get rid of that ass. So what I tell you, I'm going to ban that ass and I don't be playing. Are these NCLEX style? Yes, they are. They're NCLEX questions as well as these help on when you're in school as well. OK, and these are free questions. You can get them off nurseslabs.com. Nurseslabs.com is where you can get these. OK. All right, so what are we thinking? What is our answer? Our answer coming in 3, 2, and our answer is C, prevent DVTs. Exercise is important for all hospitalized patients to prevent DVTs. Muscular contraction promotes venous return and prevents hemostasis in the lower extremities. Health promotions and maintenance, right? But also getting out of the bed does help with constipation, does help prevent bed sores, right? Because you're still getting that blood flow moving, right? Because you're moving. But what is the most important is that we want to prevent DVTs. We don't want no clots going from lower extremities all the way up to lungs, creating any other type of issues like pulmonary embolisms or, we don't want to end up getting strokes or anything like that. Okay. That's why it's important. Hey, sometimes you got to humble yourself. You got to realize to the group of people that you talk to, right? I'm not going to go to a group of senior citizens and be like, how do you not know that? Of course, when they don't fucking know that. All right. So realize where you are and where other people are. All right, here we go. Question 15. A patient arrives in the emergency department with symptoms of myocardial infarction, progressing to cardiogenic shock. Which of the following symptoms should the nurse expect the client to exhibit with cardiogenic shock? Is it hypotension, bradycardia, a bounding pulse, or confusion? Welcome. Hey, we need 30,000 likes. Hey, I see it going. Over there on the side. Hey, get carpal tunnel for me. Make it happen right now. Also, if you're here and you're new here, welcome. We're doing NCLEX questions. I got them off nurseslabs.com. Hey, I already had to give somebody a 600. And I probably will talk about it later just because I'm petty and I don't care. So 600 means I ban you. So don't be that person. All right. I need for y'all to share. I need for y'all to like, and I need for y'all to follow. This is what gets it out to people. All right. It gets it out to the people who need it. Confusion. Yeah, I like that's funny. Also, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, what you doing here? Trying to get your learn on? You trying to fuck up the vibe in my chat? You see what I'm saying? I love y'all. You know what I'm saying? Like, y'all let me know who y'all are and what y'all do. All right. Here we go, y'all. Here's our answer. Marty is the MSN. Shout out to you. Here we go. In 3, 2, international nurse. Okay. I see you. All right. And here is it Renata? Appreciate the heart. Man, yo, we good out here. You know what I'm saying? And the answer is D. It's confusion. Cardiogenic shock severely impairs the pumping function of the heart muscle, causing diminished blood flow to the organs of the body. This results in diminished brain function and confusion, as well as hypotension, tachycardia, and weak pulse. cardiogenic shock is a serious complication of myocardial infarction with a high mortality rate. That is physiological adaptation, third largest section on the NCLEX at 11 to 17%. If you guys don't know what the NCLEX is, that is the National Licensing Examination for Registered Nurses and Licensed Practical Nurses, okay? So, nice to meet you. Nurse C, it's nice to meet you. Appreciate y'all. Shout out to all those people that are in here. All right, hey, real quick commercial break to all 900 of y'all. Don't y'all go nowhere. Make sure y'all participate. All right, we're doing NCLEX questions. I got them off nurseslabs.com. A physiotherapist, shout out to you. Participation is the key. Share, follow, give me all them likes. Get carpal tunnel for me. Share to like 100 people, whoever's in your cohort, because I know y'all ain't doing shit on Black Friday because y'all are broke just like me. Hey, if you come to my chat and you start talking shit, I will ban you. I promise you. I already banned like 2 people today. Well, one person. Don't be annoying, all right? Don't be rude. But I love y'all regardless, I promise. Nurseslabs.com is where I got these questions from. All right, you guys can go over there and check that out for yourself. My course, the 7-day NCLEX course, it's $97. You get it for a lifetime. For Black Friday and Cyber Monday, that price it's going away. It's going away. So we're working up to get into the full course. All right, so that's going away. Make sure you guys check that out. This link's right here in my bio. Also, if you're looking for one-on-one coaching, also for the NCLEX, that is also in my bio. And at the request of everyone else, everybody's like, do I do tutoring for nursing school and TEAS and HESI and stuff like that and ATI? I'm working on that too. Because that's what y'all want, and I got to give y'all what y'all want. Y'all are worse. Y'all are worse than my kids. But I'm going to get y'all. I got y'all. I promise. Here we go. Question number 16. I'm sorry. A patient with a history of congestive heart failure arrives at the clinic complaining of dyspnea. Which of the following actions is the first the nurse should perform? So based off of systematic approach, what is the very first thing I should do out of steps 1 through 4, right? Ask the patient to lie down on the exam table, draw blood for chemistry panel and arterial blood gases, send the patient for x-ray, or check blood pressure. What are we thinking? What are we thinking? C as coconut. Okay, got you. C as in coconut. Least invasive to most invasive. Okay, Sarah. Sarah, smarty pants over there. Sarah been super active today. Appreciate you. Hey, a little bit about me, in case in case you guys don't know. I've been in the Navy for 16 years. I'm enlisted in the Navy. D as in Dak Prescott. This guy. Hey, we won yesterday. Hey, 45-10, baby. Go Cowboys. Y'all already know the deal. Been in the Navy 16 years. Been a nurse for 3.5. I failed my NCLEX 3 times. I worked ICU, OR, and PACU. Yo, we got a lot going on over here. So plethora of knowledge, a plethora of journeys that go on. But I'm happy that you guys are here and we're going through it together. Go Birds. Kareem, you about to get banned. Coming over here telling me to go Birds. Ma'am, I might just ban you for that comment. But here we go. Here we go. Here's our answer in 3, 2. And the answer is D. Check the blood pressure. No, Kareem, you're good. I ain't going to get rid of you. You good, girl. You good. A patient with congestive heart failure and dyspnea may have pulmonary edema, which can cause severe hypertension. Therefore, taking the patient's blood pressure should be the first action. That is physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. Hey, listen, it's not a trick on how to study for the NCLEX. It's called putting in the fucking work, aka content, questions and answers, and then reading and reviewing your rationales. It doesn't matter if you got it right, or if it doesn't matter if you got it right, you will read it, every single one. All right, that's how you do it. Repetition. All right, that's what we do, and that's how we train around here. All right, that's how you get to a professional level. Train. Question 17. A clinic patient has recently been prescribed nitroglycerin for treatment of angina. He calls the nurse complaining of frequent headaches. Which of the following responses to the patient is correct? Stop taking the nitroglycerin and see if the headaches improve. Go to the emergency department to be checked because nitroglycerin can cause bleeding in the brain. Headaches are frequent side effects of nitroglycerin because it causes vasodilation. Or D, the headaches are unlikely to be related to nitroglycerin, so you should see your doctor for further investigation. What are we thinking? Angina is chest pain. All right, chest pain. I'm guessing somebody asked that question and y'all are answering it, so I appreciate y'all. Med student here, loving this review. Jen, I appreciate it. I'm glad you're here. Hey, so if you're, this is for both RN and LPN. So if you're an LPN, a patient care tech, a CNA, a PA, even my med students that are out there, my x-ray techs, physical therapists, my respiratory techs, like respiratory therapists. Hey, let me let y'all know, I fucking love all of y'all, because I'm telling you right now, as somebody who worked in the ICU and didn't have a lot of those people around who I wished I had, y'all are a fucking godsend, and y'all are a part of the team, and y'all should be recognized for the fact that y'all are amazing. All right. Shout out to my surgical tech. Hey, I'm a surgical tech. I've been a surgical tech for 13 years. I've been an instructor at a surgical tech program. Did that for about 3.5 years. Do LPNs take NCLEX? Yes, they do. They have their own. They have their own NCLEX. It's the NCLEX PN. All right. But shout out to all of my folks that are out there that don't have a license in regards to the nursing aspect, but you're part of ancillary services. So I appreciate y'all. I don't care if nobody ever tells y'all that. At least y'all can come here and y'all know I rock with y'all. All right. Hold on one second. Hey, also, if you come in here and you try to sell me your nudes, I'm going to like ban you too, because why would I want to buy your nudes when, you know, you can get them for free? Anyway, so the answer is C. Headaches are a frequent side effect of the nitroglycerin because it causes vasodilation. Nitroglycerin is a potent vasodilator and often produces unwanted effects such as headaches, dizziness, and hypotension. Patients should be counseled and the dose titrated to minimize these effects. In spite of the side effects, nitroglycerin is effective in reducing myocardial oxygen consumption and increasing blood flow, right? That's pharmacological and parenteral therapies, all right? Second largest section on the NCLEX, all right? Hi, Carissa. Welcome. All right, here we go. Question number 18. Hey, if you guys are new here, welcome. Keep smashing that like button. We need 40,000 likes. Get carpal tunnel for me. Bella says I'm back. Oh. You left? Who was keeping tabs on Bella? Anyways, a patient received surgery and chemotherapy for colon cancer. All right. Completing therapy 3 months previously, and she is now in remission. So shout out to her. At her follow-up appointment, she complains of fatigue following activity and difficulty with concentration in her weekly bridge games. Which of the following explanation would account for her symptoms? The symptoms may result of anemia caused by the chemotherapy. Patient may be immunosuppressed, may be depressed, or may be dehydrated. What are we thinking? Is it Rossman? Rossman? Did I say that right? Rossman says anemia. If I said your name right, let me know. Let me know. Shout out to all 640 of y'all. And make sure y'all keep smashing that like button. Make sure you guys like, and also make sure you guys share. Don't be greedy your whole life. All right. We're doing NCLEX questions. Got them off nurseslabs.com. Nurseslabs.com. All right. They're free sets of questions. You guys can go over there and check those out. Also, if you're a brand new nurse, they also do nursing diagnosis over there, and those dreaded damn care plans. You know what I'm saying? Those dreaded care plans are over there. Don't be greedy your whole life. I'm trying to tell you, don't be greedy. Dan, you already know the deal. Don't be greedy. Don't be out here being greedy your whole life. All right. Y'all know the deal. All right. Also, if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. If you're not a nurse, what you doing here hanging out with us? It says, I'm not a nurse and I'm in school, but this is fun. Madison, Maddie, I appreciate you being here. Hey, TikToker, don't rush me. Hey, I didn't realize we were on your time, bro. Or gal, or whatever you identify as, whatever. Good secret is ChatGPT was a lifesaver. Hey, it is. It legitimately is. All right, here we go. And the answer is A. The symptoms may be the result of anemia caused by the chemotherapy. All right. 3 months after surgery and chemotherapy, the patient is likely to be feeling the after effects, which often include anemia because of bone marrow suppression. All right. That is part of reduction of risk potential. All right. I'm a pharm student with COVID watching you. Hey, keep your COVID nastiness over there, Maxie. All right. All right. Hey, I really do hope you feel better, because I've had COVID twice and it sucks. It sucks. OK, just refreshing and fun. Man, Nurse Momo, I'm glad that you're here. Reduction of risk potential, ladies and gentlemen. Reduction of risk potential. It says, I just failed out of nursing school, but trying again in January. That's what I'm talking about. Hey, well, how does it go? It is delayed, but never denied. All right. You failed out. Cool. You're just delayed at this point. All right. You're not denied. Keep pushing towards that goal. A clinic patient with a hemoglobin concentration of 10.8 grams per deciliter and reports sticking to a strict vegetarian diet. Which of the following nutritional advice is appropriate? The diet is while providing adequate sources of iron and requires no changes. The patient should add meat to her diet. A vegetarian diet is not advised. The patient should use iron cookware to prepare foods such as dark green leafy vegetables and legumes, which are high in iron, or a cup of coffee or tea should be added to every meal. What are we thinking? Hey, and if you're like from Baltimore, they say earn. Oh, hey, I got anybody from Baltimore in here? Hey, you already know that's nothing but love, okay? I don't mean no disrespect. I don't need y'all coming after me. You know what I'm saying? I don't need y'all coming after me. It's definitely C. All right, cool. I got you. Be more. Hey, shout out to Madison. All right, girl. I see you. I see you. All right, what are we thinking? I'm gonna give y'all. All right, we're about to wrap it up. Next gen, please. Hey, these are the questions that are on here. So, and here's the thing. I'm going to explain the next generation NCLEX as well here in a second. All right. So the answer is C. The patient should use iron cookware to prepare food, such as dark green leafy vegetables and legumes, such as which are high in iron. Normal hemoglobin ranges from 11.5 to 15. This vegetarian patient is mildly anemic. When food is prepared in iron cookware, its iron content is increased. That's part of basic care and comfort. 6 to 12% on the NCLEX, y'all. Smaller section, but still very important. You know, dietary and nutrition is still very important, right? As a nurse, we take care of patients. It is patient driven, we don't always have to go medication, right? We want to do least invasive as possible. So I don't want to put her on any kind of medications to bring stuff up when we could change her diet and how she does stuff at home. You know what I mean? So here we go. Question number 20. A hospitalized patient is receiving packed red blood cells for the treatment of severe anemia. Which of the following is the most accurate statement? Transfusion reaction is most likely immediately after the infusion is complete. Packed red blood cells are best infused slowly through a 20-gauge IV catheter. They should be flushed with 5% dextrose solution, or a nurse should remain in the room during the first 15 minutes of the infusion. Hey, did you just give me a wristband? Is that a wristband, EB? Or a team bracelet? Oh, man. You gave me a friendship bracelet? Man, I appreciate you. I ain't never got one of them before. I appreciate you. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. EB, I appreciate you. We friends now. Friends forever. Shout out to Saved by the Bell. Yeah, I'm showing my age, whatever. Bella, okay. Oh, I ain't got another friendship. I got 2, 3. Lord of mercy. Oh, my God. Appreciate you. Oh, EB, we real good friends now. Lord. All right. Do you appreciate me? Of course. Of course. I appreciate everybody that's in here. And I mean that. And I put that on the dead homies. All right, here we go. Here's our answer. Hold on one second, y'all. Hold on. Somebody came in here trying to sell me nudies again. When are people just going to get it, bro? Like, you can get them for free. Here we go. Here's our answer in 3, 2. And the answer is D. A nurse should remain in the room during the first 15 minutes of infusion. Transfusion reaction is most likely during the first 15 minutes of infusion, and a nurse should be present during this time. That is physiological adaptation, right? What do you think of accelerated nursing? I did an accelerated nursing BSN program, and I would recommend it if you did it. Do you recommend me being a corrections nurse? I mean, I don't know. Do you want to be a corrections nurse? Seems like I feel like that you want me to give you permission to be a corrections nurse, when in reality, if you want to do it, then go do it. Hey, real quick, nursing questions, NCLEX questions, got them off nurseslabs.com, right? Nurseslabs.com. Make sure you guys go over there and check that out for yourself, okay? Check it out for yourself. They're free sets of questions. Also, participate. I need 40,000 likes, y'all. 40,000 likes. Make it happen, all right? Share, follow, give me all them likes. Don't you be selfish your whole life, all right? Get it out there to the folks who need it, all right? Get it out there to the folks who need it. Carol, congratulations to you for passing your NCLEX. Everybody give Carol her flowers right now. All right. Also, you come to my chat and you act up or try to sell me nudies, or if you over here try to tell me how to run my chat, I'm going to ban that ass. So just as long, hey, don't be rude, okay? You don't see me coming to your house and telling you to fucking put your couch up against another wall. So don't come over here trying to tell me what to do in mine. All right. Here we go. Also, 7-day NCLEX course, y'all. 7-day NCLEX course is now $97. You get it for a lifetime. I have a new generation NCLEX review inside of there, y'all. And y'all get all of the updated content as I put it in. All right. It says tell us how you did it. I don't know what you're talking about. That's going away on after Cyber Monday. All right. Also, if you need coaching, NCLEX coaching, check those links out. All those links are in my bio up here. All right. Here we go. Question number 21. Am I the only one from Kenya? I don't know. Hey, where are you guys from? Who are you? Where are you from? And where are you at in your nursing journey? Let us know. I want to know. We want to know where each other are from. I live in Texas. I specifically live in San Antonio. So shout out to all my folks. Texas, go Cowboys. Question 21. A patient who has received chemotherapy for cancer treatment is given an injection of Epotin. I always mess it up, but whatever. Which of the following should reflect the findings in a complete blood count drawn several days ago? Is it an increase in neutrophil count, increase in hematocrit, increase in platelet count, or increase in serum iron? South Dakota LPN school in 2E. Hey, Steve, I was in South Dakota during the summer. I was in Rapid City. Hey, I liked it, man. Uvalde, shout out to Uvalde. Shout out to you, Regina, third semester. Connecticut in my first year. Okay. Originally from NY, but you in Atlanta, but live in Atlanta. Man, I need Keith Lee to actually go out to Atlanta and start critiquing schools. As a matter of fact, he just needs to start reviewing all nursing schools. Yeah, I said it. Hey, if you guys are finding value and you guys like that Keith Lee joke, hey, give me the 40,000 likes. Stop playing games. All right, y'all. Chicago, just taking the NCLEX in my second time. Shout out to you. Hey, delayed, never denied, Sarah. Delayed, never denied. Florida State University. Okay. All right, y'all. Here we go. Here's our answer, y'all. Here is our answer in 3, 2. And the answer is B, an increase in hematocrit. Epoetin is a form of the erythropoietin, which stimulates the production of red blood cells, causing an increase in hematocrit. Epoetin is given to patients who are anemic, often as a result of chemotherapy treatment. That's part of reduction of risk potential. All right, reduction of risk potential on the NCLEX. One of the 8 sections of the client needs for NCLEX, smaller section, up to 12%, but still very, very much important, right? Epoetin alpha, yep. Yes, it's knocking on them. Yeah, that's right. Here we go. Question number 22. A patient is admitted to the hospital with suspected polycythemia vera. Which of the following symptoms is consistent with the diagnosis? Select all that apply. So I need to see all of them on there. All right. So weight loss. Increased clotting time, hypertension, headaches, and polyphagia. So which ones do you guys choose? All right, I'll give you guys about 30 seconds, okay? Also, if you guys are new here, welcome. We're doing NCLEX questions, got them off nurseslabs.com. If anybody is interested in a NCLEX course that you get for a lifetime and you get all of the updates as I put them in there, check out the 7-day NCLEX course. That link is in my bio. That link is in my bio. It is $97, and yes, you get it for a lifetime. All right. Also, I want to know who you are, where you're from, and where you were at in your nursing journey. Keep smashing that like button, y'all. Get carpal tunnel for me. Make it happen. All right, we got some BCD. Do you guys know any accelerated nursing programs without prerequisites? Nah, well, I don't think there's an accelerated BSN program without prerequisites that I know of. Every single one that I looked for when I was going to school, you had to have your prerequisites done before you got into an accelerated, because all it is just the nursing classes. It's nothing else. Hey, Dr. Bimbo, how about you hurry up and you just sit and relax, or you could just go away. How about that? And if you came in here when I said I'm going to give people time because it's select all that apply, you probably would have heard that. But here we go. Here's our answer. Here's our answer in 3, 2. And the answer is B, C, and D. Polycythemia vera is a condition in which the bone marrow produces too many red blood cells. This causes an increase in hematocrit and viscosity of the blood. All right, patients can experience headaches, dizziness, and visual disturbances. Cardiovascular effects include increased blood pressure and delayed clotting time. All right. Yeah, child, you was right. That's what I'm talking about. Man, you crying? I don't know what you're crying for. So, yeah. Hey, so remember, when you guys are studying for NCLEX, content, questions, rationales, right? That is the trifecta of how you are to retain your information. Appreciate all the follows from everybody. You know what I'm saying? Hey, like I told you, don't come to my chat. Don't come over here and tell me what to do. If you don't like it, go somewhere else. You know what I'm saying? I will check you at the fucking door. Best believe. Here we go. Question 23. A nurse is caring for a client with a platelet count of 20,000. Which of the following is an important intervention? Observe for evidence of spontaneous bleeding. Limit visitors to family only. Give aspirin in case of headache. Impose immune precautions. What are we thinking? Hey, if you guys are new here, welcome. Doing NCLEX questions. Got them off nurseslabs.com. Hey, we need 50,000 likes. So if you're new here, I need you to get carpal tunnel for me. Get carpal tunnel for me. You won't regret it, I promise. Also, got these questions off nurseslabs.com. I think I already said that, but I said it again. Go over there and check it out. I want to know who you are, where you're from, and where you were at in your nursing journey. All right? Everybody screaming A. Okay. Hey, remember, RTFQ. Hey, so what are the cues? What are the cues in this question that are telling you what is the most important thing? Okay, what are we thinking? But here we go. Here is our answer. 50,000 likes. Is it rich or rich? Okay, 20,000. Okay, platelet count decreased. All right, well, let's find out what it is. In 3, 2. And the answer is observe for evidence of spontaneous bleeding, right? So in the question, it says, what is the most important? right? The most important. While some of these things are important, what is the one that is going to catch my attention that could potentially harm your patient faster, right? So is it the platelet count under? Platelet counts under 30,000 may cause spontaneous petechiae and bruising, particularly in the extremities. When the count falls below 15,000, spontaneous bleeding in the brain and internal organs may occur. Headaches may be a sign and should be watched for. This is reduction of risk potential. All right. So they're going to look like that movie where they have the Ebola virus and they're just sitting there just bleeding out of the face. All right. We don't want that. So we got to be aware of that. All right. So shout out to all y'all that got the question right. 50,000 likes. Get it there. Carpal tunnel. Make it happen. Question 24. A nurse in the emergency department assesses a patient who has been taking long-term corticosteroids to treat renal disease. Which of the following is a typical side effect of a corticosteroid treatment? Select all that apply. I'm going to give you 30 seconds. And 30 seconds may be a minute, because it's called a lag, and I need for y'all to understand that. Amanda in Texas, you graduated in December. Shout out to you, Amanda. Shout out to all my folks that are in Texas, because we're the greatest state. Yeah, I said it. I'm about to, oh Lord, I done made people mad. Sorry if you guys hear my son back there. You already know he's a deviant. All right, NCLEX. My NCLEX is 11:30. Okay. Hey, that's right around the corner. Right around the corner. Best state ever. Girl, you already know the deal. All right, y'all. All right. Looks like we got, okay. Is it B Darley? B Darley, appreciate the follow. All right, here we go, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is A, B, D, and E. Side effects of corticosteroids include weight gain, fluid retention with hypertension, cushingoid features such as low serum albumin, suppressed inflammatory response, and mood swings. Patients are encouraged to eat a diet high in protein, vitamins, and minerals, and low in sodium. That is part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX at 14 to 18%. You got to know your meds. It's all about nurse safety. When to give these things, when not to give these things. What are the side effects of when I give them, and do I want to see the expected outcome? And what do I see if the unexpected outcome occurs? Okay, that's why it's so important. All right, here we go. Question number 25. A nurse is caring for a patient in the oncology unit. Which of the following is the most important nursing action when caring for a neutropenic patient? So if you don't know your content, you're not going to know what a neutropenic patient is, or what the signs and symptoms, or what that patient may display. So if you don't know that, this is how you know right off the bat you need to go study that section, okay? So here we go. Is it A, change the disposable mask immediately after use, change gloves immediately after use, minimize patient contact, or minimize conversation with the patient? What are we thinking? What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. One thing I will want to say is that the new generation NCLEX, all it did was add the how questions are delivered to you. 60 to 70% of your questions are still going to be multiple choice, and they're still going to be select all that apply. Those don't go anywhere. The other 30 to 40% are based off of a case study, but the question types are different, such as you have select all that apply that are now partial credit. They have bow tie. They have anticipated versus not anticipated. They have closed questions, aka fill in the blanks, so on and so forth. That's what you got to know. All right. But it doesn't matter about the content. They give you all the information. They give you everything that you could ever want. Right. But you got to know. You got to know your content in order to apply it. All right. So here we go. And the answer is B, change gloves immediately after use. The neutropenic patient is at risk for infection. Changing gloves immediately after use protects patient from contaminations with organisms picked up on hospital surfaces. And if you've never worked at a hospital, hospitals are disgusting. All right. This contamination can cause serious consequences for an immunocompromised patient. Physiological adaptation, which is the third largest section on NCLEX at 11 to 17%. Hey, other things that you got to be mindful for. You can't be bringing in fresh fruit, fresh flowers. They can't have standalone water for neutropenic patients. Those are things that you got to realize, especially if you're one of those people that works in oncology. Hey, I got anybody in oncology in here that can attest to that? Here we go. Real quick. Hey, commercial break, ladies and gentlemen. We're doing NCLEX questions. Make sure you guys participate. I'm kind of funny. I've been real been real annoyed by people coming in here, but they ain't killing my vibe. You know what I'm saying? Because I'm here for y'all. So participate, share, follow, give me all them likes. All right. Don't be selfish your whole life. Share this with people and follow me so you guys know when I'm doing these. I'm starting to do these every day. 5:30 Central Standard Time, Monday through Friday. I got y'all. Hey, if you come to my chat and you act a fool, I'm going to ban that ass. I promise you. I've already banned like 4 or 5 people today, and I am thoroughly fucking enjoying it. I love it. All right. Nurseslabs.com is where I got these questions from. 7-day NCLEX course. That link is in my bio. $97. You get it for a lifetime. I will talk about the overview at the end of us doing these questions. Is that for Ali? Ali, I got you. We're going to talk about it. Also, if you need one-on-one coaching, that link is also in my bio, and I'm going to do that. I'm going to do everything that they ask me anything. Okay. For real. What, Bella? Anyways, here we go. Question 26. A patient is undergoing the induction stage of treatment for leukemia. The nurse teaches family members about infectious precautions. Which of the following statements by family members indicate that the family needs more education? So apparently the family ain't picking up what I'm putting down. So what did they say that was incorrect? Okay. So we will bring in books and magazines for entertainment, personal care items for comfort, fresh flowers to brighten the room, or family pictures and or get well cards. Fresh flowers, okay. I wonder why everyone is picking C. I wonder why. You know why? It's because all of y'all are smart. You know what I'm saying? All of y'all are smart. If y'all agree that I agree that all of y'all are smart, I'm gonna need for y'all to get me to 50,000 likes and stop playing games with me. Okay, make it happen right now. Get carpal tunnel for me. Make it happen right now. We listening? Essence. That's what I'm talking about. It's the essence of me and you. Essence. For smashing the like button. That's what I'm talking about. Yeah, look. Hey, look. Is it Titta? Look, I didn't tell you nothing. What you mean? I don't know what you mean. All right, y'all. Here we go. Here's our answer because y'all already knew the answer because y'all are some smarty pantsers. You know what I'm saying? So here we go. In 3, 2. Hey, Shondell, I didn't tell you nothing. Hey, but the answer is C. You know what I'm saying? Why is the answer C? Because y'all are smart and y'all knew the answer. You know what I'm saying? We can't bring in fresh flowers. During the induction chemotherapy, the leukemia patient is severely immunocompromised and at risk for serious infections. Right? Fresh flowers, fruits, and plants can carry microbes and should be avoided. That's part of health promotion and maintenance. They can take it like a champ. They just weak, right? Fresh flowers can cause infection. Yes, they can. For somebody who is immunocompromised, who doesn't have an army to fight off just the simplest infections. Yeah. Nasty bacteria going to get up in there and tear that ass up. You know what I'm saying? You were telling us the precautions before. First of all, user 90, I ain't say nothing. And I'm taking that to the bank. I plead the fifth. All right, here we go. Question 27. The nurse is caring for a patient with acute lymphoblastic leukemia or ALL. Which of the following is the most likely age range of the patient? 3 to 10, 25 to 35, 45 to 55, or over 60 years of age. Oh my God, I hadn't thought about that. And I'm an MD. Look at that. That's what I'm talking about. See, hey, just because you're a doctor don't mean you can't learn things every day, right? I had a doctor who had been a surgeon for 40 years and he had no idea what gap insurance was. And when I told him, he was just dumbfounded. He was like, really? I'm like, yeah. He's like, shoot, I should have been doing that. I'm like, exactly. All right. 15 seconds, y'all. 15 seconds. 15 seconds. Okay. Is it right? Is it rake? Rach? Is it rach? Did I say it right? Let me know. Just give me a thumbs up or a thumbs down if rach is it. If it's not, then rach. I said it right. Rach. So rach or rake. Rachy. Rach. Rach. All right, I got you, Rach. I got you. Here we go. Here's our answer, y'all. Here is our answer in 3, 2. And the answer is A, 3 to 10 years old. The peak incidence of ALL is at 4 years of age. Age range from 3 to 10. That is part of health promotions and maintenance. Hey, remember, if you don't know this is where you got to go follow up and you have to get your content. You got to get your content. Hey, who is that? Leanne. Hey, so you guessed right. Cool. You know what I'm saying? I would rather you guess. If guessing gets you 25% chance of getting it correct rather than not answering it at all. Okay. So just, hey, if you don't know this content, this is how you know how you audit yourself. Hey, I need to go back and I need to go look at that for about 30 minutes to an hour. You know what I mean? So here we go. You're welcome. Here we go. Question 28. A patient is admitted to the oncology unit for diagnosis of suspected Hodgkin's disease. Which of the following symptoms is typical of Hodgkin's disease? Is it painful cervical lymph nodes? Is it night sweats and fatigue, nausea and vomiting, or weight gain? ALL, all little kids. Okay, CC. Hey, that's really good. I never thought about that. I like that. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Hold on, y'all. I got to give somebody a 600. Hold on. Tra-la-la-la-la. All right, cool. What are we talking about? All right, let's go. Let's fucking go. Hey, we need 60,000 likes, y'all. We need 60,000 likes. If you guys are finding value and if you guys aren't greedy, you guys have been sharing. Hey, make all that happen. Get carpal tunnel for me. Make it happen right now. Right now. All right. Also, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what you doing here? Are you learning something? That's the biggest thing is, are you learning something? That's what I want to know. Even if you feel like it's simple, is there something that is in here that is new to you that you picked up that you could share with somebody else? B, taking NCLEX in January. Nurse Z, I appreciate the rose. I appreciate you. Is it Sassvini? You're learning? I love it. Hey, who said, what's the answer? Oh, I'm about to tell you the answer. Man, y'all coming in here and y'all act like I'm on y'all time. Lord of mercy. Here we go. And the answer is B, night sweats and fatigue. Symptoms of Hodgkin's disease includes night sweats, fatigue, weakness, and tachycardia. That is part of physiological adaptation, which is the what? The third largest section on NCLEX. Been a nurse since 2017. Shout out to you. Is it Miriam? Miriam. There it is. Third largest section on the NCLEX at 11 to 17%. Remember, you need content, questions and answers, and rationales. That's what you need. That is what you need, ladies and gentlemen. All right. Make sure you get it, because that's how you're able to go back and, and improve upon where you weren't doing so well. You gave me a turkey. Gobble, gobble. Appreciate you. Here we go. Question 29. The Hodgkin's disease patient described in the question above, aka previously, undergoes a lymph node biopsy for definitive diagnosis. If the diagnosis of Hodgkin's disease were correct, which of the following cells would the pathologist expect to find? Is it the lymphoblastic cells, Reed-Sternberg cells? Is it the Gotcher's cells or Reeder's cells? What are we thinking? Shout out to all 600 plus of y'all up in here rocking with me. I appreciate y'all. Hey, I just want to let y'all know that I love y'all. If nobody's ever told y'all that, I love y'all. I love y'all and I appreciate y'all. And y'all are going to do fucking great in nursing school. Y'all are going to do fucking great as nurses. Hey, always take care of yourself. All right. I'm being dead serious. If nobody's ever told you that they loved you, I fucking love y'all. Put that on the dead homies. And I mean that in the most respectful way possible, just because, we're nurses and we see people die. But whatever. 10 seconds, y'all. 10 seconds. Nursing school in January. Okay. Shout out to you. Is it JC? Thank you for the follow. Tita, appreciate the hearts. Is it Yukon? Yukon? Thank you. Dead homies is crazy. I'm trying to tell you. Here we go. Hold on one second. It says, as a nurse, this question is irrelevant for your career. Yep, I agree. Because who's really going to see it? Only people that are, unless you're going to go up and be like an oncology nurse practitioner and you're going to start seeing these things where you diagnose. And yeah, I agree. There's a lot of things that shouldn't be in the book, but hey, everybody got to get the standard, right? So here we go. The answer is B. It's the Reed-Sternberg cell. A definitive diagnosis of Hodgkin's disease is made if Reed-Sternberg cell are found on a pathologic examination of the excision of the excised lymph nodes. That is physiological adaptation. I'm a BMT nurse. Okay, BMT nurse. This does help sometimes. Hey, I'd rather it help sometimes than not help at all. You know what I mean? So. Hey, physiological adaptation, third largest section on the NCLEX, right? Third largest section on the NCLEX at 11 to 17%. RNBSN at 22 years old, hang in nursing school. It's not easy, but it's worth it. Hey, nursing school is a monster. Hey, remember, those things that are put there for you in nursing school are to keep people out. So how much are you willing to put up with and to get through that hardship in order for you to get what you want? I wish you were my teacher. I'm in nursing school, bored as ever. Look. I'll tell y'all about that later. I was an instructor. I've been an instructor for the last 8 years. But not for nursing, but just for other things. Here we go. Question 30. The patient is about to undergo bone marrow aspiration and biopsy and expresses fear and anxiety about the procedure. Which of the following is the most effective nursing response? Response, therapeutic, right? Warn the patient to stay very still because the smallest movement will increase her pain. Encourage the family to stay in the room for the procedure. Stay with the patient and focus on slow, deep breathing for relaxation, or delay the procedure to allow the patient to deal with her feelings. What are we thinking? I'll give y'all 15 seconds. Hey, if you're new here, we're doing NCLEX questions. Hey, we're trying to get to 60,000 likes, and it seems that people are tired. You know what I'm saying? People tired out here, so I need for y'all to just murder that thing. And I mean that respectfully. You know what I mean? Murder it. Get carpal tunnel for me. Also, I want to know who you are, where you're from, where you're at in your nursing journey. If you're not a nurse, what do you do? And are you getting value from this? Ben Francis, he said C is obviously, well, for you it's obvious, but it's not obvious for other people who aren't where you are. No time for breathe, but what you mean? Hey, look, I'm like an auctioneer out here. I'm a CNA. Shout out to you. Shout out to you. Just passed my NCLEX in June. You're from Kenya. Okay, 2 years. Okay, this is helpful for everyone. I love it. Havana Unana. Thank you for the follow. Appreciate you. And the answer is obviously C. Man, I'm petty as fuck. I'm sorry. Stay with the patient and focus on slow, deep breathing for relaxation. All right. Slow, deep breathing is the most effective method of reducing anxiety and stress. It reduces the level of carbon dioxide in the brain to increase calm and relaxation. All right. That's part of physiological adaptation, which is the third largest section on the NCLEX exam. For those that are just now starting nursing school, the NCLEX exam is the licensing exam that you have to take. Hey, once you get through school, you ain't finished. You got to study for this board exam, okay? And this is what the stuff that we're going over. I'm an NCJ in Canada, and I'm going to take the RN NCLEX in January. Shout out to you, Rach. Shout out to you. Felt like yesterday. Sarah, I bet it did. I took my NCLEX 5 years ago. No, 3 years ago. Sorry, I've been a nurse for 3.5 years. There we go. Graduated nursing school 5 years ago. Hey, and ladies and gentlemen, that is a wrap on the NCLEX questions. A triggers anxiety. B is a... wait, what did you say? Yep. You can't postpone procedure. In fact, you can't. It's either you cancel it or you do it. So that's how it goes. I'm a teacher, but always wanted to be a nurse. Hey, Lauren, you can still be a nurse. Hey, so that's it. That's it for today, for Friday, for the questions. I appreciate everybody getting me to 60,000 likes. Y'all are the real MVPs out here. I really do love and appreciate y'all for all the likes and all that. Hey, I had to ban like 6 people. Most of them were because they were trying to sell me nudes. When you can get nudes for free, bro. Like, what you mean out here? So I'm petty. And that one dude who came in here and tried to rush me, hey, I enjoy banning your ass, and I hope you come back in here with another name so I can ban you again. Once again, I got these questions off nurselabs.com, nurseslabs.com. You know what I'm saying? Wait, somebody who passed the NCLEX on Wednesday? Girl, that's what I'm talking about. Hey, y'all see it. Y'all see her. Is it Angie? Oh my God, I'm going to mess your name up. Hey, y'all give her love right now. Y'all see her. Give her love right now. Tell her I'm going to fuck your name up and I don't want to mess it up. And if I do, I'm sorry. I don't want to do that. But yo, hey, everybody give her love right now. Congratulations to her. Welcome to the greatest shit show on earth. Welcome to being a nurse. Give us one tip that you could tell everybody here about what you did to prepare for the NCLEX, all right? And then tell them, how you can get through it, all right? Also, 7-day NCLEX course. Y'all, I'm about to pull it up right now, and I'm about to show you, okay? I'm about to show you what it is and what you get. Also, I'm going to show you what the inside looks like, but I want y'all to give her love right now, okay? Anyways, hey, we're going to jump right into it right now because I know a bunch of people asked me about it, so I am going to show you right now. So, ladies and gentlemen, this is kind of what it looks like. And there's that dude. We don't know who he is, right? So this is the Black Friday deal, right? And it's going to end on Black Friday, Cyber Monday. I didn't want to put Cyber Monday up there because they got too big, right? So here it is, right? And down here, I'm just gonna take you straight to it. Down there, right? This is the Black Friday deal. Hey, so you see the normal price, right? $347, but you get this for a lifetime, AKA you get everything that's updated. This review is being worked on currently, is going to be up there very shortly. The new generation NCLEX review is also in there. You're going to eventually get over 100. I have about 55 videos in there right now. You get access to the private Facebook group. You get monthly updates. And yes, this is for both RNs and LPNs. Okay. That's what it's for. And then here's our frequently asked questions. Also, if you don't like it, within 7 days, while that policy is there, hey, if you don't like it, cool, I'll give you money back. I don't want your money if you don't want to be there. You know what I'm saying? But I've had people that are in there and they love it. They love it right now. You know what I'm saying? And I'm trying to tell you, for $48, when I had it for $48, that was a steal. You know what I'm saying? But however, you guys get all this information. I'm about to show you right now. Now we're inside of the course. If you guys are looking for the course, go to the link in my bio. It is labeled 7-day NCLEX course, and it'll take you to that page that I just showed you. All right. Click on enroll and it'll take you directly there. Okay. So here we go. Here we go. Here we go. These are the things that you guys get right now. Inside, I have videos talking about the computer adaptive test. Oh no. Hold on a second. I don't know why it logged me out. Apparently it hates me. Apparently it hates me, right? All right, here we go. Just kidding. All right, here we go. So talk about critical thinking. We talk about, all kinds. So here we go. Here we go right here, y'all. So here's the thing that everybody wants. With my NCLEX review, check this out. Who else passed NCLEX? I've taken the NCLEX and your presentations are spot on. I would wish I had it before I took it. Sophia, I appreciate you. I appreciate your feedback. I really, really do. Hey, so right here on the 7-day NCLEX course, y'all, inside I have an 8-section video. It's almost 4 hours total of content, right? And we're talking about the new generation NCLEX, the intro, the changes, the questions, the test plan structure, and then we talk about the length, and then we jump right into questions. And to answer your question, somebody was like, "Hey, are there new generation NCLEX questions in here?" And there are, and I'm about to show you right here. So case study. You see that case study right there, right? There go to case study right there. On your NCLEX, you're going to get case studies. They're going to be at least 6. You're going to get, sometimes you'll get 1, but you're going to either get 1 or you're going to get 6 based off of a case study, right? And that's where I have dyslexia and I said that backwards, right? So I put that edit in there, so don't laugh at me, all right? So we talk about the case study and then we jump into the question items, right? And you will see this pause. This is me telling you to pause the video, read the question, pick your answers based off of the topic of how we explained it or how I explained it. You can refer back to the case study and then answer your question based off of the information that was given to you, right? And then we jump back into it. I tell you which ones are wrong, why they are wrong, which ones are right, why they are right. Because we jump into that's why it's so important that you read your rationales. My NCLEX had so much NGN. I bet it did. I bet it did, because the new generation NCLEX is what it's all about right now, right? And by new gen, all it is just how the questions are delivered to you, because I'm sure that you still had multiple choice, you still had select all that apply. And remember, those are incorporated also inside of the case studies. Is this review for LPN, RN? No, they're both for RN and LPN. They're both for RN and LPN. Right. And I talk about these. Look, select all that apply. And I'm going to find them. And here's another one. Hey, does this look familiar? We talk about anticipated versus not anticipated. Right. Think about that. Hold on. Who said that? Is it Alexan? I'm really hoping I'm saying your name right. But tell me if that looks right based off of what's on the NCLEX. Like you have your indicated versus not indicated, right? You have anticipated versus not anticipated. You still have select all that apply. You still have your multiple choice questions, right? So we go over that. Like, look, y'all, look, 8. And each video is 30 minutes or less. 30 minutes or less, y'all. So you want to know why? I've been an instructor. I've been an educator. I've been a teacher for the last 8 years. I taught 3.5 years in a surgical technology program. I was a tactical combat casualty care instructor, pre-hospital trauma. I'm currently a trauma nurse instructor, as well as I taught advanced burn, and I'm a preceptor at my job, all that good stuff, right? So I understand, as an educator who sits at the podium, who the hell wants to sit in a room for a whole hour listening to me run my mouth when I could just condense it, give you all the important stuff that you need, and then you go on about your day, right? And that's what the 7-day NCLEX course is about, y'all. That's what it's about. You can go over up to the link in my bio, right? And it'll take you, go to link in my bio, 7-day NCLEX course. It'll take you there. You get it for $97. Where did you teach at? I taught when I was in the Navy. So I taught at a surgical technology program here in San Antonio, and I taught in another bunch of programs at the Defense Health or the Defense Health Agency, which is a big push for the military to go to DHA. So that's what I did. How many months did you study before taking the NCLEX? For me personally, I failed the NCLEX 3 times, y'all. I failed it 3 times, but when I passed, on the time that I passed, I studied. It was less than 60 days. So it was about 54 or 56 days, somewhere along those lines, right? But then also, look, you get content, right? Talking about prep, we got, time management, lab values, legal rights and responsibilities, the interdisciplinary team, restraints, how to create a study plan, which seems to be very hard for a lot of people. And right here, pharmacology, y'all. I got 18 videos. 18. And I actually plan on putting more in here. But here's the kicker, y'all. I am going, like, once you buy it, it's yours forever. It says, yo, you said at San Antonio, I'm an x-ray tech in the Army. Yeah, I was at, you're an x-ray tech. So x-ray was like in like MIF 5. No, they were in like MIF 1 or 2. You were like 1 or 2, close to the shopette. I know where y'all are at. I was in MIF 3, and I was like I said, I was a surge tech instructor, so I know exactly what you're talking about. I know exactly where you are, and I know exactly what you're talking about. But here we go, pharmacology, y'all, right? And I have, we're in MIF 5, because respiratory is in MIF 5, I think too. How much did you make as an X-ray tech? I wasn't an X-ray tech. This guy is at Bow Lake is an X-ray tech. Fluid electrolyte imbalances, your hypos and your hypers. Cardiology, I have 8 videos that are in production that are going to be going up here, and I have endocrinology, right? So as I said, for $97, you get all of this, and plus you are going to get more. And by more, I'm going to have over 150 to 200 videos in here. Large flex that you could ever have is getting an NCLEX course for $97. So you guys can check that link up in my bio. I will show you guys right there. That is the link right there, thebootnurse.com/special, and that's the special for for Black Friday and Cyber Monday. Okay, so enough about that. I am going to turn this thing around so you guys can see my hideous face. Shout out to y'all. What's up? Hey, shout out to Attack on Titan for all my folks that are there. Where the hell were you when I was in nursing school? Ma'am, look, I was probably in nursing school with you. You know what I'm saying? That's probably where I was. But shout out to everybody. I appreciate it. Hey, if you guys have been finding value in all the things that I've been saying, I want y'all to smash that like button. Listen, I got to 100,000 likes on, I want to say it was on Tuesday. That's the most likes that I've ever gotten to. And so I would love for me to get back there, right? Hopefully everybody had a really good Thanksgiving. Like I said, a little bit about me. Been in the Navy for 16 years. I am now in the Navy Reserves. Also, I've been a nurse for 3.5 years. I've worked in ICU, OR, and the PACU. ICU, I've worked burn ICU. I've worked medical and a neuro ICU. Hi, Kevin. Please bring same price, which was yesterday because of my sickness. Will it go back? It will not go back to 48. And here's why it won't go back down to 48. Because I've been talking, it's been $48 since June, and I've done nothing but talk about it for especially over the last week, right? So it will most definitely remain at $97. All right, it's like, I'm in the Army, not too so not much. Oh, okay, that makes sense, I guess. Right? No, you're good. But yeah. So, did you say you've been a nurse for 3.5 years? Yes, I said I've been a nurse for 3.5 years. I said that. I've been a nurse for 3.5 years. I've been in the Navy for 16 years. Of those 16 years, 13 of them has been as a surgical tech. I've had 2 deployments. Went to Afghanistan, part of a forward surgical team where I got to do nursing stuff, which was great. Like nothing like that. What nursing agent did you advise? What do you mean? What nursing agent did I advise? What you mean? I need for you to give me a little bit more context. But what other questions do you guys have? All right. While you guys get those questions going through, I do also do NCLEX question or NCLEX coaching. That link is also in my bio. You can check that out. Thank you for your service. Amanda, I appreciate your support. It's always loved. It's always needed, right? If I could, I'd be part of the Survey Corps. No, I wouldn't. Slaying Titans. We ain't doing all that. Shout out to all my folks that like anime, right? Do I practice? Do I practice working as a nurse? I do currently, but we'll see how long that lasts. Right? If I decide I want to keep doing that, right? So, but yeah. So, yeah, what questions do you guys have? You guys had a lot of questions while I was going through the review. So what questions do you guys have? Craziest story? I got a lot of crazy stories. It says nursing agency like the sorts of Avance and MedPro. So I was staff. So I just went directly through staff. I didn't do an agency. I served 10 years in Walmart with Gail Lewis. Stop it. I had to turn in my boots when she left the service. That's funny. Do you plan to open a college? That would actually be pretty cool if I did open a college. That would be pretty cool. How long have you been a fish? Don't know what that means. Oh, how long have I been at Fort Sam? So I got to Fort Sam December of 2014, and I got off of active duty in 21, and my reserve center is still here. So I've been here since almost 10 years. No, 9 years. 9 years. My dad is retired from the Army. I'm a military brat. Shout out to you. How do you like nursing compared to surgical tech? Previous CST for 5 years. Shout out to you, Kendall. And I graduate RN in December. Surgical tech, I mean, they both have their ups and they both have their downs. Just with the RN, you have more responsibility. As a surge tech, we think we have all the responsibility. Well, at least military surge techs are a little bit different. So I'm hoping I get BAMC as my phase two. I don't know why they wouldn't send you to BAMC. That's usually where they would send you, unless they want to send you to, like, El Paso, which is probably where you're going. Or maybe they don't call it Bragg anymore, wherever one Fort Bragg. Or they'll send you to Hood. You can go to Hood, you know what I'm saying? So what else we got? I'm in school to be a surgical tech. Shout out to you, Seth. Hey, like I said, I've been a surgical tech. I'm still technically a surgical tech. According to the Navy, I still have my national cert. I've been a surgical tech for 13 years. Like I said, I was an instructor for surgical tech as well. Did that for 3.5 years down at Fort Sam. Honestly, it was probably one of the best jobs I've ever had in the Navy, was teaching. And it literally, if it wasn't for that experience, I wouldn't be here on this live teaching you guys. All right. So what other questions do you guys have? Hey, also, like I said, y'all, I failed my NCLEX 3 times. I failed it 3 times. First time, it was 75 questions. Second time, it was 265 questions. Third time, it was 106 questions. I can't wait to I have one more year. You watching from the barracks? Hey, man. Janky, no, you're not. You're in the Army. Never mind. You're in Janky and Fralish Hall. But I don't know. The Army, hey, good on you, man. Good on you. Good on you from watching from the barracks. You shouldn't even be watching me. You should be getting your learn on if you're in X-ray school. But you picked the right C school, let me tell you. You picked the right one. I think X-ray is probably the best one. BC, hey, okay. Not me being like, oh my God, I know where that's at. But yeah, what other questions do you guys have? I'm going to hang out here for about a good half an hour. I had somebody ask me, do you have to be a nurse to sit, or do you have to go through nursing school to take the NCLEX? And the answer is yes. You have to go through the whole process of going through nursing school and graduating before you can take the exam, because you're dealing with the public, you're dealing with safety of people. So for you to just think, oh, I can go and take this test, like I said, this ain't catch me if you can. Okay, it doesn't work like that. I'm a nursing student, second semester, and I want to make the most of my degree. I want to travel. Lil Mama 95. Here's one thing I'll tell you is you want to travel. So think about where you want to go and where you want to work. Okay, so if you want to go to med-surg, OB, ICU, wherever, when you get there, you need, my personal opinion, and what I would highly, highly recommend is that you get at least a minimum of a year, but it would be ideal to have 2 years working on the floor and then traveling as that nurse. Because when you become a travel nurse and you go to places and you're making 3-4 times the money that the staff nurses are making there, they will give you the train wrecks of patients and they will give you the shit shows, because they're going to be like, oh, you're making more money than us, so you get the hard patients. And that's what they'll do to you. And they'll leave you hanging. I'm trying to tell you, you want to try to protect yourself as much as possible. So get all the knowledge that you can. Okay. I appreciate the follow. What is it like being a guy in nursing? Was there any sexism? I had an issue with one of my professors in my first semester. She didn't like me because she was telling me about sterile technique, and I'm a surg tech, so you can't tell me about sterile technique because that's all we do. And so I had to realize I had to turn off surgical tech and I had to turn on nurse. And her and I got back and forth, and I had a couple of clinical instructors that would talk to me like they're crazy. And I turned them out, I was like, hey, so you don't have to convey your message like that to me. I'm not your husband and I'm not your son. So don't talk to me like you're crazy. That's number one. I'm asking you, honestly, I'm having an issue. Can you please convey that in a different way? And they're just like, oh, yeah. And I never really had any problems. I didn't have any problems after that. I didn't. It says, hey, a level 3 ER nurse job waiting for me. Okay. Will be a clinical tech in the ER in 3 weeks. Shout out to you. Hey, go over there and get that knowledge. Kev, why they making nursing harder than it really is? Nursing school, because everybody wants to do it. So you want to know the great thing about marketing? Lil Mama, you're welcome. You want to know the great thing about marketing is that they put it out on the TV. They put it out on your ads. They put it out everywhere saying, be a nurse and, take care of your patients. You do it because you want to do X, Y, and Z. So every young girl wants to go be a nurse because they want to follow in their parents' or mom's footsteps, or they feel like they have a calling. That's what they'll tell you, right? But in reality, it's because everybody wants to do it, and it's competitive to get in, right? And because they can. That's the reality of it. 38 years as a nurse. Can't wait to retire. 6 more. Hey, you can retire now. You stayed a lot longer than I would have, but shout out to you. But you could have retired now. That's a lot. That's a lot of time. How long after graduation did you think, do you think I should wait before taking the NCLEX? Ma'am, you should take the NCLEX ASAP. A-sippity sap. Soon as you graduate, soon as you get that authorization to test, you need to schedule that exam. The reason being, the longer that you wait, the less information you can retain. Okay? Carol says, I passed my NCLEX. Carol, you already told us that, I thought. You told us that. We gave you your flowers for it. You want to what? Well, little mama, you want to do what? Hey, but shout out to y'all for the questions. I'm going to hang out here for another 20 minutes, okay? So whatever question you guys have, it says, you ever think about commissioning? Sure, sir. I have put in multiple commissioning packages. So now I have no thoughts, wants, or desires to commission at all. None whatsoever. I'm taking it within the first month of graduation. Yes, definitely. You want to take it as fast as possible. I want to pass. I want to be the best nurse. So I'm going to tell you something right now. If you want to pass, you need to put the work in. Then the work comes from you. Nowhere else. Okay. 2, keep coming to my lives. Okay. Because, we drop in gems, not just me, but other folks in here. All right. Number 3, only you can determine the best nurse that you're going to be. All right. The one thing I'll tell you is hang around those nurses that are not going to be toxic, because not toxicity within the nursing realm. And it's because of you. And I say you, I mean women, because nursing is 89% women. And there's a lot of mean girl effects. Like you can have some really good relationships there, but there's mean girl effects that happen a lot. You hear me? A lot in the nursing field, right? So if you want to be the best nurse, to be the best nurse, you got to be the best you. You got to do you first in order for you to be the best nurse. And if you're not there for that, then, it could be a difficult time. Your first year of nursing is going to be tough. You're going to go through imposter syndrome. It's going to suck. That's for everybody. It's going to really suck because you're going to be like, why am I here? I'm not even competent to do this. I should have did something else. Trust me, you're not the only one. Everybody goes through it. I've not met not one person who hasn't gone through imposter syndrome. Okay. So just be ready for that. But don't say you want to pass, and don't tell me you want to be the best nurse. Tell me you will pass, and tell me you will be the best nurse, right? You want to solidify that, You telling me that you want something means I wish. No, don't make it a wish. Make it a guarantee. Is it worth it to go F&P? User 7-3. That depends on you. Do you want to be an MP? Do you want to do that? If you want to do it, most definitely it's worth it. SJ Briggs, you're dealing with imposter syndrome. Trust and believe me, we all go through it. All right, bet. I should get my ATT first week of January. Hey, as soon as you get it, find the first one. Get on the first thing smoking. All right, taking NCLEX 1129. Can't wait to take it. I feel so ready. That's right. Go in there with that confidence that you're going to kill that exam. As you failed your NCLEX, that's cool. I failed my NCLEX too. So do you want me to pat you on the shoulder and tell you that it's okay? Or do you want me to tell you to get it the fuck together and figure out why you didn't do so well? And let's tackle it together. You see what I'm saying? That's love, SJ, I promise. That's not coming from a place of ill intent or nothing like that. But I don't coddle. But I will tell you, hey, if you're willing to put in that work, we can make some stuff happen. Yes. And Yellow, hey, you already know. You know what's up. Is it a Bow Lake? You know what's up. That military mentality, it comes into play, right? It's kind of like make a good decision now rather than try to make a great decision later, because by waiting to make a great decision, it could cost you lives. And that's the same concept when you start working as a nurse. Hey, should I do this or should I do that? This would be better, or this would be better. Hey, how about we start CPR? The fuck are you doing, bro? You know what I'm saying? So think about it like that. Everyone, please say a prayer for me or keep me in your positive thoughts. Taking mine in 2 months. Grace, you're going to be all right. All right. How long do you typically recommend to study before scheduling your exam? First of all, Michael, you schedule your exam ASAP, and you should be studying before you graduate. My recommendation is that you study, if you graduate in May, you should start your studying process no later or no earlier than March. So that gives you like a good month to 2 months before you graduate. Then you take your NCLEX. It's already fresh in your mind. Boom, you go take it. Don't limit yourself in your content when you are preparing for NCLEX. That's right. You'll hear some people say, well, I didn't study, endocrinology because I was worried about pharmacology. No, study it all. It's not about memorization. It's about being familiar about the information and being able to recall it. Right? Anybody can memorize what the 12 cranial nerves are. But if I throw out a scenario about somebody coming and telling me that I have a problem with me swallowing, what cranial nerve is that? Oh, it's cranial nerve, blah, 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 blah. Right? But then what is the issue with somebody that's swallowing? Oh, they're a possible aspiration. Oh, they're a possible airway issue. You see what I'm saying? That's how you have to move. That is what the critical thinking does in order for you to make a clinical judgment. Okay. If you guys are finding value, smash that like button. Okay. Hey, 70,000 likes, smash that like button. That's what I want to see. Hey, what other questions do you guys have? You guys are on a roll and I appreciate it. Hey, if you guys are new here, welcome. My name is Kevin. I'm a nurse. We do NCLEX questions at the beginning. We did NCLEX questions for around an hour 15. We do that. We're going to start doing that every day, Monday through Friday, 5:30 Central Standard Time. All right. But I need those likes. I need those follows and I need those shares. That is the trifecta that me and TikTok needs in order to get this information out to people. All right. Also, 7-day NCLEX course, y'all. 7-day NCLEX course is $97 and you get it for a lifetime, which means all content videos that I am going to put up there, you are going to get. So if you start nursing school here in January and you don't graduate for a whole nother year, one of the biggest flexes you could ever have is saying, hey, yo, I got an NCLEX review for $97. And it's a lifetime while you got to go pay a subscription. I'm not saying that it ain't going to a subscription yet, but right now, it's for a lifetime for $97. So you guys can go over there and check. That link is in my bio. Also, if you want coaching, like one-on-one coaching with me, if you need somebody to light that fire under that ass, because best believe I will do it, you can check that link out in my bio as well. Okay. It says, does it go over NGN? Yes, SJ, it does. As a matter of fact, I will show you exactly right now what it looks like. Okay. I will show you exactly. First of all, I'm going to show you what the website looks like. Okay. So right here is the website. That is my glorious face. It's kind of hideous, but whatever, you know what I'm saying? So 2 days. Hey, so this is the Black Friday deal. I'm going to show you guys. I need that push. I'm trying to let you know. And then down here, you guys can scroll down, but I'll take you all the way down here. Here's the Black Friday deal, $97. And this is for both RNs and LPNs, ladies and gentlemen, RNs and LPNs. Here's the thing that's different between RNs and LPNs. With LPNs, you need to know what you can and can't do, what you can and can't accept. That is it. That is it. There's no difference. You learn the same exact content. You learn the same exact content, right? So when you get here, then you would click the buy now and it'll take you to that checkout page, right? But this right here is what you get, right? So I'll start off right off the bat. I'll start off right here. You get 8 videos in the new generation NCLEX. This is the review and this is just for the new generation NCLEX. I still haven't put the review out for my 8 sections of the client needs, right? So right here, we talk about content. We talk about the changes. We talk about, the new questions, as well as I talk about the test plan structure. We talk about the exam length, and then we jump right into questions. I read the questions. We talk about the topic of the question, because once you understand what this topic is asking you, you are able to recall content. All right. You use AdPi. AdPi will never go away, but you use it to recall content. And then I tell you why these answers are incorrect. Incorrect. And then I tell you why this answer is correct. And then you will see a pause button that'll jump on here once I find it. Nope. Come on, guy. So you'll see pause buttons jump up. That is your cue. Okay. That is your cue to know that pause the video and then recall your question, answer it yourself, right? So in reality, even though this is a 28 minutes, this should take you probably double that time, right? Sit there, answer it, and then we go on. All right. But all I'm asking is for you to take 30 minutes out of your day to watch it. That's it. When will the 8 categories go up? So those are actually being recorded right now. Like when I get off my live, I go on and I record them, and I'm on the 4th one right now. Hey, these things. Hey, I'm a one-man army. I do all of these all by myself, to include the editing and then to include setting up everything. So, I'm a one-man army. I can only do so much. So they go up. That's why I say every month, every 2 weeks to a month, depending on what I got going on. Right. So that's a good question, Amanda. That's a good question. So right here. And then also, I'll show you guys right here. We go over new generation NCLEX style questions. I'm going to show you. Somebody asked, does it include NGN? I got you. Hold on. Let me find it. All right. Case study. Boom. Right there. Case study. We go over the case study. We talk about all the findings and all the information. Everything that's in there. Sorry if you guys hear my son. He's being dramatic. Mostly it's because he's a toddler and he runs the house and doesn't pay no bills. So we go over new generation NCLEX, right? the findings and all this stuff. You guys see that edit? That's me being dyslexic because I said that word backwards, all right? But I wasn't going to re-record it after I figured it out, all right? So we go through, and then here's your first question. It says, that was me. I'm doing 6, but I worry that's not enough. What you mean, Michael? You're doing 6 what? Because I running through the 6 with my woes. I'm sorry. But yeah, so we go through it. Right? And then here's another one. Select all that apply. Remember, select all that apply are partial credit, right? And then here's another one. Our close or our drop down questions, right? So these are going to look very familiar to you Yeah, when you go and take your exam, right? And that's what it looks like. I highlight them. We talk about them. Okay. And then we have a case study again. And then you'll see other questions like anticipated versus not anticipated from my question above. Hold on. Let me see. I'm doing 6. But I'm worried that's not enough. You're doing 6 what though? Oh, above that. I didn't see it. Let me see. Let me see what you said. I didn't see what you said. I don't even know where it's at. Oh, how long do you typically recommend to study before scheduling your exam? Oh, how many hours? You do 6. Okay. I got you. I'm tracking. So it all just depends on you and how much time. I always recommend doing anywhere between 3 to 6. But when I say do 3 to 6, I mean for it to be consecutively. I don't want to see you do 10 minutes here, 20 minutes there, because you have to build your endurance. You have to build your endurance to sit for that exam, right? You have to build it, right? And like I said, notice 30 minute videos, right? Do a 30-minute video and then go and, take your notes on or whatever, and then go on about your day, right? And then here's another one right here. Indicated versus not indicated, right? I got bow ties in here as well. Multiple choice, select all that apply, right? And then at the end, on number 8, let me go back. So we have, there's 100 questions in here. There are 100 questions in here, right? And if you're interested in the 7-day NCLEX course, check that link in the bio. It's for $97, y'all, $97. Every video is less than 30 minutes, right? And I do over 100. I go over 100 questions. We talk about how to evaluate your progress, like using a study guide, right? Your practice exams, all those things, your study plans. We go through that. And we also go through memory tricks, we go through memory tricks, delegation, prioritization, EKG strips, cardiomyopathy. We go over anticoagulants, antiplatelets. We go through contact precautions, respiratory labs, all that stuff. It says, that's what I'm lacking now. I failed twice and now I have no motivation, but you said access is forever. It's more than 7 days. Just want to double check. SJ. So it's considered, I call it the 7-day NCLEX courses, because when you go and you do a review, we'll say like with Kaplan, with Kaplan or Archer or Hearst, they have those 3-day reviews where they cram everything into you, right? And you're just like, damn, I got a headache. How am I going to retain this information, whatever? So instead of doing it over 3 days, I did it over 7. And all I'm asking you is to give me 2 to 3 hours out of your day to sit there and get that knowledge in. That's all that means. So instead of doing it in 3 days, let's do it in 7, where you can kind of take your time, right? Hey, give me 2 to 3 hours out of your day. And here's the thing. You get forever access because it's on demand. You get it because it's on demand. So it also helps you have and maintain your accountability for your exam. Okay. Does that make sense? It says, but I can go back more. Yes, absolutely. You can go back more than once. You can go back forever. You can go back as much as you want. As a matter of fact, when you decide to get it, I want you to go in there and I want you to fact check me. Right? Fact check me, go and look, right? And then I want you to just let me know, am I lying or am I dying? You know what I'm saying? It seems like a good deal. Spent $600 on different tutoring courses and didn't gain much. So here's the one thing I'll tell you is I spent a total of almost $3,000 to get a license from reviews, courses, and having to pay the Board of Nursing and Pearson VUE to take my exam. I froze. Can you hear me? Can you still see me? Carol, a recent pastor, I would advise on reviewing according to client category needs. You said I spent, I can hear you. Okay. SJ, can you see me? I'm good. I'm over here dancing, looking like a fool. You said, so the last thing you heard me said, I spent almost $3,000 or right around $3,000 to become a nurse, after school, right? So, programs, courses, Pearson VUE, Board of Nursing application, almost $3,000. All of that, right? And that's why I said, if you go to my website, I spent $3,000 so you don't have to, right? And right here, Carol says, as a recent passer, I would advise you reviewing according to your client needs. So I would agree with that, but I would also want to add on to this. Within the client needs, they have areas where it's just like, I didn't do well. Me personally, I didn't do well in pharmacology. So I knew pharmacology is where I had to start. Pharmacology is where I had to start. Okay. So that is how you want to start the process. Okay. That is how and where you would want to start the process for sure. Okay. But yes, if everybody's looking for that review for $97 and you get it for a lifetime, AKA you can go back, look at the reviews. You can go back and review them as much as you want. On top of, on the content videos, you get downloadables. So you get the same PowerPoint that I have. So if you need to print it out and you're a read write and you want to go through the PowerPoint with me and take notes, you can do that as well, right? Those are in there for you. Hell, there's some of them where I've given like an example of, like other things to specifically look at. Okay. So check that out. That link is in my bio. Also, one-on-one coaching, right? I do one-on-one coaching. I actually had a young lady that just recently passed. I have another young lady that I helped who recently passed probably about 2 weeks ago. She is now an LVN, right? Now out there living her best LVN life, right? And now I have 4 other people that are going to be taking their NCLEX within the month of December, right? And that's what the one-on-one coaching comes from. Like, you get this, you get me. Like, there's nothing different from this that you would get in a one-on-one coaching session, right? And if you're interested in doing that, that includes one-on-one coaching session, private sessions with me. That also includes we break down NCLEX style questions together. So that way, wherever your mindset is on why you're not able to understand questions, even content, rationales, we break them down together and make them more relevant for you to understand. We also put you on a study tracker study tracker and a study calendar. Where do you need help with? And we're going to start there first, right? And then of course you get nursing mentorship. I get asked questions all the time. Kevin, where should I start? I don't know. Let's have a deeper conversation, right? Let's have a deeper conversation about that. Also, you get unlimited motivation. One of the things that sucks about the NCLEX, especially when you fail, is that you feel like you don't have a good support system. But even if you don't, relatively around you, you got me. Even if you didn't have the coaching, you got this. You got the people that are down in the chat. You got all that. You know what I mean? So I give you that unlimited motivation, right? I got a video that I'm about to put up of a young lady who I helped pass, and it's going to be one of the testimonial videos that's going to be up there that I want everybody to see. Because she put in the work. She was able to be coachable, and she put in the work in order for her to be successful. And that is what coaching is all about, right? LeBron James has had a coach ever since he's been in the league, and there's a reason why he's been in the league for 20 years. There is a reason why LeBron James has been in the NBA. I don't care how you feel about him, but there's a reason why he's been in the league for so long. It's because he's had somebody who is a professional and an expert at what they do to keep him being at optimal speed and condition in order for him to perform at a professional level at the way that he does at his age, right? So that's why coaching is important. And if you're interested in that link is up here as well. All right, that link is in my bio. It is labeled NCLEX one-on-one coaching, right? And also 7-day NCLEX course. That link is above it, right? $97. Heather, I'm bored and on call. Just here to show you some support. Happy Thanksgiving. Heather, what's up? Happy Thanksgiving. Hey, don't be bored over there making money on call. You know how that go, right? So what other questions do you guys have? How long is this sale for? Grace, the sale is going to end on midnight of Cyber Monday. So you have today, tomorrow, Sunday, Monday. And then Tuesday at midnight, going into Tuesday, it's gone. And it's going to go to its regular price. It's regular, but you're going to have it forever. So even if you got it at regular price, you're going to get all of the updates. Okay. So make sure you guys go over there and check that out. What other questions do you guys have? I got about 5 minutes before I got to roll out and, get some content recorded for you guys. What other questions do you guys have? Hey, if you guys are new here, welcome. We do NCLEX questions Monday through Friday now. Monday through Friday now at 5:30 Central Standard Time. All right, 5:30 Central Standard Time. We're going to go over NCLEX style questions, and then we're going to do an Ask Me Anything if you decide you want to hang around for it. And yeah, we'll just chop it up. So what other questions do you guys have? Also, if you guys are new here, or even if you're in here, I want to know who you are, where you're from, where you're at in your nursing journey, as well as if you're not a nurse or trying to become a nurse, what you doing here? What you doing here hanging out with us? What do we got? What do we got? Nobody. Everybody's so quiet here on this Friday. Y'all act like y'all got to go Black Friday shopping. Y'all act like I got to go Black Friday shopping out here. I am what? Lala says what? What are we thinking? What are we thinking? Also, I created a ebook, right? And that ebook is going to go up sometime today or tomorrow. I know some people are just like, where can I get it? I want it. That ebook is going to be $29, but it's over 700 pages of content that is relevant for you guys on NCLEX, right? That's coming. I'm new, studying for the LPN test in December. Lala, so welcome. So you're studying for the NCLEX LPN and you take it in December. So shout out to you. Hey, so the 7-day NCLEX course is also for LPN NCLEX takers. Okay, so that's also something to be aware about. Anybody looking for any of my links, you guys can check them out in my bio. Also, I also have a YouTube channel, y'all. So if you know y'all know that I do TikToks, every other day. Well, it was every other day. Now it's every day. But you guys know that if you guys miss a TikTok, these questions will be on YouTube, and you guys can go over there and check those out. Okay. I'm just star. Been at LVN for 2 years, but starting my RN on January. Shout out to you. Go out there and kill that exam. Okay. Hi, I'm Grace LPN, graduate of RN ASN. Oh, you graduated in 2022. Gotcha. Shout out to you. Laureen from the Philippines, or RN from the Philippines, inspired to take the NCLEX. Thanks for the 7-day. Oh, Laureen, did you buy it? Okay, awesome. I don't know if you bought it. I didn't see anything come in, so I don't know if you bought it. So if it's helpful for you, Laureen, if it's been helpful for you, let us know. Like any feedback, whether it be positive or negative, I want, because I want to be able to improve this program. And the thing about it is, like, it's no longer mine. It's y'all's. It's y'all's program now. Any advice on how to do reduction of risk potential? Like next question. Any tips for NCLEX RN? I don't know why I'm not understanding your question. I need advice on how to do reduction of risk potential. Oh, like you mean like first versus best? Is that what you mean, Danny? Like first versus best, or prioritization questions, like who do you see first? Is that what you mean? Yeah? Okay. So it's all about ADPI, right? So you're assessing versus your implementation, like which one do you do first? So here's the thing about first is first can be said in many different words, right? It could be said first, priority, immediately, like right now, right? So think of it as what my patient's gonna die if I don't take care of them. That's how you know. That's how you know based off of what you need, who you need to pick first. And now this is where it goes to content. Now you have to use your critical thinking. What is my patient displaying that would kill them before I got to the other 3 patients, or 4 or 5 or whatever that they decide to give you, right? So, like, do I see a patient who's, 75 years old who has COPD, or do I go see the 19-year-old that has acute asthma? You know what I'm saying? Both are respiratory things. You know what I mean? Those are both respiratory things, but who's going to die? Which one's acute? Which one's chronic? Right? Yeah, acute versus chronic. There you go, right? So I want to see an acute person before I see a chronic person, right? But what if I have somebody who has acute exacerbated what if they're a 19-year-old and they have exacerbated OCD, but they have exacerbated asthma, but their O2 saturation's at 96? and my and my COPD patient has rigid abdominal distension and was in a motor vehicle accident, then who would I see first? You see what I'm saying? That's how you have to pay more attention to the modifying phrases than the original noun, right? But then if you're paying more attention, the question, the unexpected is first. The unexpected is first. And who would be the unexpected? Would it be the asthma or would it be the COPD? You see how I added those modifiers to it because those modifiers right there could change how the question is. Yeah, from the diagnosis of the COPD. Yeah, so my patient has COPD, right? So that's a chronic issue, right? But is it normal for a COPDer to have abdominal distension, right? And abdominal rigidity and have bruising? No, it is not. So that is abnormal. That is an acute issue. I need to handle that person first, or they are going to die. And most times along in your head, you're just going to be like, oh, well, that's probably a GI bleed because let's think of the mechanism of injury. How did they get here? Motor vehicle accident. Okay. You see what I'm saying? And that's how you approach your, those are like management of care questions, right? That's how you approach those. All right. Hopefully that answered your question. All right. Well, ladies and gentlemen, that is going to be it for me tonight. I hope everybody had a wonderful Thanksgiving. I hope everybody still finds value in me doing these questions. A couple little housekeeping things that I want to go through. Make sure you guys follow me on Instagram, YouTube, Facebook. You're welcome, Danny. YouTube, Facebook, Thread, Twitter, whatever. Follow me on all those spots, right? Also, the 7-day NCLEX course, y'all, $97. Thank you. We'll look into purchasing. Oh, I appreciate you, Grace. Like I said, that link is in my bio. 7-day NCLEX course, y'all, $97. It's up here in the link in the bio, and you get it for a lifetime. No jokes, no nothing, no Ponzi scheme, no scam, no nothing. That's not how I work, all right? Plus, y'all know who I am, and y'all know where I'm at. You know what I'm saying? Like, what the fuck? But also, if you're looking for one-on-one coaching, tutoring for the NCLEX, check that link out in my bio as well, all right? You guys have a wonderful weekend. You guys be safe. Also, give yourself perspective. All right. Give yourself perspective. You are right where you are supposed to be. Okay. So you guys have a wonderful weekend, and I will see everybody on Monday. Bye.